Welcome to A Date with Darkness podcast, where we will be discussing the impact of hurtful and abusive relationships and how to overcome them so that we can move through our pain to get the kind of healthy relationships we want, need, and deserve. I'm your host, Dr. Natalie Jones. I'm a licensed psychotherapist based in California. While I hope that you find this podcast educational and informational in nature, please note it should not be substituted for treatment with a licensed mental health professional. Hello and welcome to the show. It has been quite some time since I've released a podcast episode, and you know, there's just been a lot of stuff that has gone on, a lot of stress, and this has been a heck of a year, both personally, professionally, socially, culturally, and just a lot of things that just crazy kind of stuff going on, an epidemic. So just getting caught up in the whirlwind of that, plus trying to manage everything else, put the podcast on the back burner for a little bit. But I'm happy to inform you that I am back and ready to go with some fresh new episodes for 2020. And I have some excellent guests that are lined up, as well as my YouTube channel for the podcast is up, Date with Darkness YouTube. I'll put that link in the show notes. I also have my other YouTube channel, which is Out of Darkness, also by me. So that's also been another project that I've been working on, as well as, the blogs and things like that. And a Date with Darkness Facebook group. Come on over and join us if you have not yet joined. That group is pretty spectacular. It's buzzing. We have some discussions about topics around hurtful, abusive relationships, narcissism, healing, what have you. It just kind of goes on. So I definitely think that that's another free resource that you can find very useful. On with today's show, I have an excellent guest that's lined up for us today. He's been around for a long time. Has written one of the most, I would say, one of the first books that stands out for me on understanding narcissism or people with those kind of traits. And the author that I have on the show today is Dr. George Simon, and he's going to be discussing his work with people with character disturbances in his books. I'm so glad to have you on here. You are one of my favorite authors. You've written a lot of books that I think that the listeners will find invaluable. But for those of my listeners that don't know who you are, can you tell us a little bit about who you are and what you do?
Yes, so thank you. And first of all, thank you for having me on your program. I appreciate it. I'm Dr. George Simon. I'm a clinical psychologist, presently semi-retired, more these days than semi-retired. And for much of my career, I had the dubious distinction of dealing primarily with character-impaired people and their aggrieved relationship partners. And that's what got me interested in this line of work and prompted me to write several books about the topic. So it's been an interesting career, to say the least.
I would say the least, and I'm sure exponentially things have just kind of taken off recently. I know that narcissism seems to be a buzzword, but I do kind of want to back up a little bit and talk a little bit about the books that you've written. Can you talk about those?
Sure. My first book, In Sheep's Clothing, really kind of put things on the map. At the time, I was seeing a number of relationship partners of various character disturbed people who were experiencing what we now call the gaslighting effect. We didn't even have a name for it back then. But these people felt crazy. And after I talked with them for a while, it was clear they weren't crazy at all, but there was someone in their life who was making them feel crazy. And once we got into understanding why, this person in their life was making them feel crazy with all these manipulation tactics that they were using, then everything began to make sense for them. And so I thought, there must be more people out there experiencing the same thing. And so the very first edition of In Sheep's Clothing, long after I began uh, distributing it at workshops, professional workshops, the very first edition of In Sheep's Clothing came out in 1995. And from the opening words in the introduction, "You're not crazy after all," word of mouth just kind of spread like wildfire.
Mm.
And before long, it became an international bestseller. So, it's been in mass publication since 1996. It's in over 30 foreign languages. We just signed 4 more foreign rights deals. We sign more all the time.
Wow.
So this is a worldwide phenomenon with expert manipulators who know how, you sense in your gut that there's something really not quite right about them, but somehow they make you feel like there's something wrong with you for
Mm-hmm.
thinking so. Um, and now we have a term for it. And it's not just narcissists that can produce this effect with you. There's all kinds of character impaired people.
Mm-hmm.
And so in my second book, Character Disturbance, I outlined all of the various character impaired types and how they manage to get the better of you, and what life is like with them and what you can do to make your life better and more empowered. And especially, I wanted to write about what you need to look for in the way of getting help, because a lot of people were reporting what I call therapy-induced trauma,
Mm-hmm.
which is what happens when you go to get some help and you end up feeling worse because either the therapist doesn't really understand, or maybe they get bamboozled by a really good impression manager who knows how to say all the right things and do all the right things. So that's what prompted me to do that. And then, of course, I wrote 2 other books, and I'm finishing one right now. I'm actually rewriting a book that was supposed to be released about 4 years ago called, it was going to be released at that time under the title, The 10 Commandments of Character. It's essentially what we need to do to turn around this tide of rampant character dysfunction in our society, and the time-honored principles that we have to teach our children and that we have to do, that we have to observe ourselves in order to be decent people again.
Mm-hmm. Um, I recall reading In Sheep's Clothing, and I think in the beginning you had talked about, I think you were talking about how you were presenting on the character disturbances and things like that. And during your presentations, and people weren't very receptive of it at the time, that they kind
Mhm.
of, they walked out of your presentation. Um, and I feel to a certain degree that that is still uh, plausible, that people still don't really accept that. Can you talk a little bit about that experience and what you think that's all about, that people just were, they rejected that and walked away from that?
Yeah, well, that was a long time ago now.
Yeah.
And it's so interesting how things have changed because, until COVID-19 struck,
Mm-hmm.
I was back on the circuit giving lots of workshops to professionals. And I'm now used to heads in the audience going like this and nodding in the affirmative and eyes
Mm-hmm.
widening and lighting up, and people saying things like, "This makes so much sense," and maybe this is why I haven't been getting anywhere in my work with my clients. But it wasn't that way in the beginning. There are a lot of folks who are actually still allied um, with perspectives that just aren't very appropriate or effective when it comes to dealing with disturbed characters. You know, our old traditional perspective saw everyone as riddled with fears and anxieties and insecurities and unconscious defenses that basically made them do all of the things that they do. And so the cure, as it were, would be to help them to see what they either don't or can't already see about the underlying fears and insecurities driving their behavior. Well, I wish that this were true for everybody. When it is true, therapy work is very easy. But when it's not true,
Mm-hmm.
and it so often these days is not true, some folks just plain don't grow up. Some folks are still on a moral development level about 4 years old. And it's not because they're riddled with fears and insecurities that they don't understand and have built defenses about. They just never embraced the principles necessary to function in life like a decent human being. Uh, I'll give you an example. I don't want to get really political about it, but even the sister of our, or excuse me, not the sister, the aunt of our president, who happens to be a psychologist, describes very accurately troubling behaviors on the part of our president.
Mm-hmm.
But she ends her book with the same tired, worn out, and I can't emphasize enough, incorrect perspective that underneath it all, he is what he always has been, and that is a frightened little child.
Mm.
This kind of perspective will only further disempower you if you're in a relationship with someone like this. You will only, in your mind, find reasons to excuse their behavior. You will see what you think is a wound underneath that you might be able to nurse to some health. And it's only going to make your life more miserable. These kinds of perspectives have been with us forever. There is no empirical validation of them, and they're damaging. In our day and time, when people just don't turn out very well because of other reasons than the traditional reasons that we've thought, adopting those perspectives can really disempower you. So I urge people not to fall into that trap. And I spend most of my professional workshops laying out for therapists the cardinal qualities that make for the kinds of characters that we have traditionally called neurotic, the folks who are truly struggling with inner wounds and inner insecurities and fears and anxieties, and have unconsciously built defenses against them. I explain what those people look like and why our traditional methods help such folks. And then I contrast that with the character disturbed among us who don't fit that profile and do not respond to the kinds of methods that we developed to help neurotic individuals. And once the therapists get that, once they understand that we have a very different crop of character among us these days for a lot of sociocultural reasons, then the whole ball game changes.
That's excellent points. And I do want to follow up with that, but I've heard you use the word character disturbance. And although you and I might know what that means, I don't know that the listeners know what that quite means. Can you talk a little bit about what a character disturbance is to you?
Yeah. Well, that usually takes an entire workshop to describe, but if we're going to really simplify it down to the basics, the folks that we call neurotic, who are a therapist's dream to work with.
Mm-hmm.
These are bright, insightful people who are just wounded and worried, and they want to work out their issues with somebody. They bang on your door, they ask for the help, they appreciate it when they get it. These folks, on the one hand, have a pretty active, sometimes overactive, very well developed conscience. Character disturbed people, on the other hand, what distinguishes them more than anything else, now I could go into a long, long list that would take a whole workshop to describe, but the main distinguishing feature is that they don't have such a well-developed conscience, and some have no conscience at all, which is why they're able to do the things that they do without any apparent compunction.
Mm-hmm.
And we scratch our heads and we say, don't they see what they're doing?
Mm-hmm.
They see just fine. It's not that they're not aware. The problem is they don't care. I say that rhyming little mantra over and over again in my workshop. It's not that they're not aware. The problem is they don't care.
Yeah.
They don't have the kind of inner voice that most decent folks have, that pushes them to do things they'd rather not do for the greater good, and that keeps them from saying and doing things that would hurt people.
Mm-hmm.
They just do as they please, and they feel completely entitled to do it. And it doesn't matter who gets hurt in the process so long as they get what they want. They're spoiled little brats who never grew up, and the whole ball game is different. And I know I've spoken in terms that some therapists would find offensive,
Mm-hmm.
but I mean no offense. And I can tell you this with absolute certainty. In my work with disturbed characters themselves, I had to develop this art of benign confrontation. They have to know that what you're really all about is only purely love, which is really wishing well for everyone involved. So they have to know that in order to have any kind of trust. But they also really appreciate you calling it exactly as it is. I've told people, for example, that I think the main issue is that they think entirely too much of themselves.
Mm-hmm.
It's not the what you say, it's how you say it.
Mm-hmm.
And believe me, they know when it's true. And if you misinterpret their behavior, or you try and find excuses for them, even unwittingly, if you try to cast them as that wounded child who doesn't really understand what they're doing,
Mm-hmm.
they will just kind of look at you and think, you know, this person doesn't get it and they don't get me.
Mm-hmm.
There's no reason for me to trust them and let them guide me, but I can play along and maybe I can even manipulate them too.
I would agree with that. And I'm curious to know your thoughts about this. People with character disturbances, do you feel, in your expert opinion, that that's a mental illness?
Well, you see, a long time ago, we broadened the definition of mental illness to include these maladaptive behavioral styles. I'm in the camp that is unsure that it was wise to do that.
Yeah.
Because there are some mental illnesses where the brain chemistry has insidiously gone wrong, and in what we call endogenously gone wrong. In other words, it went wrong on its own accord.
Mm-hmm.
The brain is no longer working right. It's not the person's fault. They didn't choose it. And their life is as miserable as everybody else's life. And we are only, a few decades into having the kinds of pharmaceuticals that can actually help restore these imbalances that occur. It's no panacea. If you know anybody with a genuine mental illness, just the medicine they take is not a perfect cure by any means.
Yes.
So I think it's time for us to make a distinction
Mm-hmm.
between genuine endogenous mental illnesses, things that just go wrong in the brain that have nothing to do with a person's habits or preferences or anything like that. I think we need to separate those from behavior patterns that a person becomes comfortable with for one reason or another.
Yes.
Um, but I think we're a long way off from that.
Yes.
And besides which, within the field, even though we've now described these maladaptive behavior patterns and we've included them in our manual of official disorders, we say that certain of these disorders can't be treated.
Mm-hmm.
This is false too. What's true is that you can't possibly treat these disturbances with methods that were designed for something else. But the problem is that very few therapists are trained in the methods that can actually help.
And yeah.
And even so, even when you are trained in the methods
Mm-hmm.
that can actually help, it's hard
Mm-hmm.
work with very little guarantee of any kind of success.
I would agree. I would agree. And I'd like to jump over to that for a little bit if we may, because there is some controversy around whether or not you can treat someone with a character disturbance. I know what my thoughts are on that, and I'd like to know what your thoughts are, because I feel that you can, to a certain degree, depending on how far of the spectrum that they are, and their treatment isn't going to look, as you say, like the typical neurotic person, meaning that they're not going to change, and their change is going to look vastly different. But I'd like to know what your opinion is on that.
Well, you just said it. You just said it beautifully there. It really depends on where a person is on the spectrum of character dysfunction. There are two spectra, one of quality and one of degree. We now know that so many disturbances, so many what we classify as mental illnesses occur along various spectra. We realized this very big time in the area of the developmental disorders, especially the autistic spectrum. And, for years and years, we were seeing children who were very mildly on the spectrum, and we gave them all kinds of crazy labels, and we didn't really understand them, and we didn't have any clue how to help them. But they were mildly on the spectrum. They didn't even they didn't even qualify for classifications of what we now call Asperger's disorder. But they were there and they were on the spectrum the whole time.
Mm-hmm.
And that's the way it is with character disturbance. We're also realizing that our old, tired, and kind of worn out, nice little pigeonholes for the different personality types, those criteria are fairly arbitrary and don't hold up under a great deal of scrutiny.
Mm-hmm.
So what we're realizing is that you can have a personality or a character dysfunction and have elements of all kinds of problematic traits, from narcissism to antisociality to
Mm-hmm.
psychopathy, to all kinds of traits in that character disturbance. So the short answer to your question about can they be helped, it depends on the nature of the disturbance and how severe it is. With any condition, any medical condition, that same rule holds true. the likelihood of a successful outcome of treatment has much more to do with how serious the problem is and what its type is. You know, if you have a really, really aggressive if you have a really, really aggressive cancer and it's in the end stages, you know, you could have all kinds of state-of-the-art treatment. There's nothing wrong with the treatment, but the likely outcome is poor because of the nature of the beast, so to speak.
Mm. I would agree. I would agree with that. And I would also agree, or that I would also say that a lot of people, similar to the people that you were talking about in the beginning, that feel like these people are like scared, frightened, and wounded, spend a lot of time around that,
Yeah.
that concept of wanting to help. But I think from your viewpoint, we should do things a little bit different. So when therapists are working with someone with a pretty significant character disturbance, what is your recommendation in terms of treatment protocol?
Yeah. As anyone in any other branch of medicine would tell you, you deal with the most serious stuff first.
Mm-hmm.
And there are folks who have some degree of neurosis, but also have plenty of character disturbance. And as a therapist, if you key in on the neurosis that's there, uh, once again, the outcome of your intervention is going to be poor. You can always deal with that. Neurosis, I might offend some folks out here. Neurosis is kind of a picnic for both the client
Yeah.
and the therapist.
Yeah.
Dealing with bright, conscientious people who are wounded inside and who really desperately want to talk with somebody and get it all out and work it all through, they are an absolute joy to work with. Plus, they really get a lot out of talking to somebody,
Yes.
just talking to somebody. So you can do that any old time. But if you've got any degree of character disturbance there, you need to tend to it, and you need to tend to it first because it's causing all the trouble in a relationship. The neurosis part is easy. You can do that later.
Mm-hmm.
But a lot of therapists make that mistake.
I would agree with you there. And I would also agree that, there's a fair amount of training that goes into, working with people, diagnosing people with those kind of things. What would you say to the mother, the love interest, the, co-parent that is involved in a relationship with someone who has that kind of disturbance? What sort of recommendations would you give to them?
Primarily one, and that is stop trying to be the parent or the understanding therapist. That may be what the person wants. It's definitely not what they need.
Mm-hmm.
What they need is someone to hold them accountable so that they have some incentive to grow up. And by accountable, that means setting appropriate boundaries and limits, not tolerating certain things, expecting certain other things, imposing consequences when that doesn't occur,
Mm-hmm.
um, taking good care of yourself, and sending the message to the person who's involved with you, hey, I'm not here for your pleasure or for your abuse either. I care for myself. And if you want a relationship with
Yeah.
me, you got an act to get together. Once somebody gets that message, if they're not too far on the spectrum, they'll maybe have some incentive to grow up and maybe have some incentive to seek some counseling on their own. I've
Mm-hmm.
seen this hundreds and hundreds and hundreds of times. Right now, my consultation schedule is fuller than it has ever been, not with people in relationships who want my advice because their partner is character disturbed. Most of those folks have already read some of my work, or they've gone to the blog and read articles, or they've read other people's material and they've come to some awareness. But increasingly, folks are contacting me in their mid 50s, 60s sometimes, reeling what a mess they made of their lives and a lot of other people's lives. And they finally decided that it's time to grow up, but they have no idea how to do it.
Mm.
And so they reach out and say, well, what do I need to do? Can you help? Can you give me some tools? Can you give me some advice? And I have worksheets and I work with them, and I don't talk to them often like a therapist would, because the burden's on them. Once they have the worksheets and once they know the protocol, it's up to them to do the changing. And then they check in with me every couple of months and report on their progress. And if they're still in a relationship, their relationship partner can verify whether or not they've really been working as hard as they
Wow.
want to claim.
What what do you say to those people like that who are reaching out to you for a consultation and they have spent years in this kind of dynamic and they're not really sure what they want, but they kind of get the sense of what's going on, but they've just been spinning their wheels and their energy on this other person. What do you say to that?
Okay, this is something that I wrote about early on with
Mm-hmm.
sheep's clothing, and I really emphasize it in my books, Character Disturbance and How Did We End Up Here. There is a behavioral formula for most depressions that are not endogenous. In other words, most depressions that are not strictly the result of biochemistry gone
Mm-hmm.
awry. There is a behavioral formula for how you get depressed most of the time. And that formula is putting all your energy and your attention into a person, place, or thing that you have no power or control over. And this is the behavioral manifestation of what Seligman called the learned helplessness paradigm.
Mm-hmm.
When you've got all your energy invested in something that you haven't the power to make happen, the first thing that happens is you get frustrated, then you get angry, then you try to direct the anger outward, but that doesn't do any good anyway. So the last thing that happens is you direct the anger inward.
Mm-hmm.
You find yourself to be your own enemy because you can't do anything to change things. And so your helplessness turns into hopelessness, and that's the behavioral formula for depression. And the formula for joy is just as simple, but merely the opposite. Put your energy and attention into those things that you have the power to control, namely your own behavior.
Mm-hmm.
You have the power to choose. Don't choose the same old thing, choose something different, anything different. Uh, don't fight that same old ridiculous, pointless fight. Say no.
Absolutely. I would agree with you 100% there. You talk about someone being covert versus overt.
Mhm.
And covert is obviously not as easily identified to some people. Can you talk a little bit about what someone who's a covert, aggressive, manipulative personality might look like?
Right. Yeah, my book In Sheep's Clothing
Mm-hmm.
is about a certain kind of manipulative personality. We all manipulate to a certain degree,
Sure.
but certain personalities manipulate for a lifestyle. They enjoy using other people as toys. And these covert aggressives, as I call them, some folks have called almost a psychopath. They enjoy toying with people, uh, pulling their strings. And how they do it is they play on your conscientiousness. They generally hook up with folks that have a pretty big conscience, and they use such techniques as guilt tripping and shaming and
Mm-hmm.
other techniques to make the other person feel bad because that other person has a conscience and doesn't want to be a bad person. Whereas the covert aggressive does not have the same kind of conscience and just wants to win, just wants to have power over you, just wants to have their way, and would rather you just kowtow to them and cave in to their demands. And so they use these clever little tactics to get you to do that while looking good in the process. This is the art of what we call positive impression management.
Mm-hmm.
It takes a while to see these folks for who they really are. And unfortunately, as I say in the book, it's like getting whiplash. You know what's happened long after the damage has already been done. And you know how it's happened long after you've finally figured it out. It takes years and years of heartache many times to finally wake up. And the help of some good information, which is, basically why I wrote my books. I have to say this because I'm working on this other book, which means a lot to me. It's probably going to represent the culmination of my life's work because I believe we're in unprecedented times.
Mm-hmm.
And I'm going to get a little political again here, not political, but just to illustrate a point. Because it bespeaks the character of our times and why we have so much character dysfunction. It should have been over when the leader of the free world during the campaign stood up in front of everyone in the room and unashamedly mocked someone with a disability without any compunction. In years past, it would have been over. But the great blight on the culture of our time is that behavior that was once seen as outrageous and indicative of the worst kind of character is not only tolerated, but we've become so desensitized and so used to it that we not only permit it, but encourage it. So I'm spending my time revising a book about what we need to do to be sane again, because this is sheer madness.
I would agree that there's some acceptance for bad behavior, again, as we're seeing now with a whole lot of movements and things that are going on even today that, people want to pop out and justify. You've kind of seen an evolution of this where people were not willing to, even take into account what you were presenting on when you first started with this topic to, then people started listening and coming to you and wanting these consultations to now we're back here as to what you've described. Tell me a little bit about why you think our generation or our society has become so desensitized to this type of behavior.
Okay. Character and culture have an interrelationship that is dynamic. And what's been going on for the past several decades is simply this. As more and more character disturbance emerged among the culture, it has eroded standards of behavior that were once in place to help shape people's character. And as those standards have eroded, more character dysfunction has occurred. And as more character dysfunction has occurred, the standards continue to erode. And as the standards continue to erode, character dysfunction increases. It's a steady, spiraling, vicious cycle that's been going on for several decades now. And what I'm working on may not even a little bit stem that tide. But before I leave this planet, I feel obliged to put it out there. I didn't know what would happen when I wrote my first book. I published it as an independent little book at first, but word of mouth turned it into something that a publisher finally wanted. You know, and then as more and more people got exposed to it, they turned it into something that people wanted almost everywhere. So, you know, you just got you do the right thing because it's the right thing, and what happens as a result of that is not really in your hands. So I want to do my part to help uh, turn the tide, and I don't know whether it will, but I'm going to give it my best shot.
Sure. And I appreciate that. And I've appreciated all the work that you've done. One of the questions I would like your opinion on also is, you know, even from a societal standpoint, or just kind of, you know, even from the people and relationships that you worked with, how can people that are within the bubble, how do they, how can you determine that you're being manipulated in a sense?
Well, the surest way is to pay attention to the tactics. Good manipulators prefer certain tried and true tactics. So when you hear that excuse that sounds plausible, but when you really think about it, doesn't really justify a person's behavior, or when they try to blame you, cast themselves as the victim just because you brought something to their attention, or when they act confused when you know you have got them dead to right, or when they use any of the other tactics, that gives you an insight into their personality, their character, and how they operate. And all you really have to do is decide in your own mind, you know, it doesn't matter what they throw at me.
Mm-hmm.
It doesn't matter. I can expect all kinds of tactics, but I know that this behavior that they've been engaging in is just not right. It's not loving. It's hurtful. And in loving myself, I need it to stop. And if they're not
Mm-hmm.
willing to stop it, I got to take some kind of action and hold them accountable. It's really pretty. It's that simple, but it's not that easy.
Yes.
Yeah.
Yes, I would agree. And, you know, in doing that, um, what do you recommend in terms of disarming the power from people who have the characteristics?
Just not letting the tactics sway you.
Yeah.
Make your decisions based on what you know to be in your heart, in your own best interest. Don't let the tactics sway you. Don't allow yourself to be a prisoner to the tactics.
Yeah.
Let them rattle on and on and on and on. That's what they're going to do anyway.
Yeah, I would agree. My question to you is this, what do you notice, or what are some of the commonalities about people that kind of get caught up with these, you know, manipulative personalities? Is there something that, you know, in your work that you've noticed in terms of what makes people more
Yeah,
susceptible to be?
yeah, we actually have some research data now that supports what I first conjectured in my book, Character Disturbance,
Mhm.
uh, about the folks who seem to be more vulnerable to these types. But the fact is, anybody can be vulnerable.
Mhm.
Anybody. There are some folks that are so good at this art of impression management. I know one. I know one such person. Everybody loves this person. There isn't a person that I can think of that would think of this person as in any way a self-serving personality.
Yeah.
It's just amazing how well polished some of these folks are.
Mhm.
They, um, I did an article on my blog just recently about what the researcher Theodore Milan calls the amorous narcissist. In his research, he uncovered 5 narcissistic types. The research today says there are 2 main types, but there are so many sub-varieties. But the amorous narcissist is an inherent connector, knows just how to make that connection with people, and they know they're good at it, and they know what people need, and they're really attentive to that. But their ultimate aim is to make you fall in love so that they can have what they want with you. And when that's over, you're over because they don't really have any more use for you. But on the front end, um, they can be real charmers. And the charm alarm does not go off because it feels so good. Um, and I also have other articles out, and I say this in my book that will be coming out, I hope soon, that um, on the front end of these relationships with these really charming people, the person on the other end mistakes what appears to be a mound of interest for regard. Interest and regard, genuine regard, are 2 different things. A person can be interested in you for a whole lot of reasons. And that interest alone is flattering. You think, boy, they must think I'm all that. And it really is intoxicating. Um, there's a number of reasons why somebody can be interested in you and have absolutely no real regard for you. They might see you as a meal ticket. They might see you as the kind of conscientious person that will be there for them no matter what the heck they do, and support them in anything they do. They might see you as a trophy. They might see you as a whole lot of other things as opposed to having genuine regard for you and a genuine heart to care for your heart. So, unfortunately, these days, anybody can be a victim. Some folks are more prone, especially those who do not have a very good self-image, who anyone's interest is going to make them feel like somebody for the first time in their life. There are also those who, for one reason or another, may have a grandiose sense of their power to nurse people to health. They may get into a relationship where they see, where they think they see a wounded child that only needs a whole bunch of love and affection to get better. There are all kinds of things that can make a person vulnerable. So there's no hard and fast rules. But here's the real statement of our time. There's so much character dysfunction out there.
There is.
In everybody.
Yes.
That all kinds of possibilities are out there for dysfunctional relationships,
Yes.
which is why we don't have marriages that hold together. It's why families fall apart. It's why there is so much bonding trauma for our children, why they don't feel safe with their hearts. We have to do something about this. We're coming apart at the seams. In one of the workshops, workshops that I was doing early on, do you remember the case of Freddie Gray?
No.
Freddie Gray was a young black man in Baltimore who supposedly had a severe neck injury while riding in a police van on the way to jail, and he wasn't buckled down well enough, and supposedly, according to reports, he hit his head on something, and that severed his spinal cord. Well, I got to tell you, that I was mesmerized by this case, not because so much of the tragedy, but because of the kind of heart that it took. the kind of hardened heart that it took for an officer sworn to protect and serve to be dealing with someone who was dying, who was already dying, and was begging for someone to save his life. And it would a good portion of it was caught on tape. And I don't know how many people you can go to YouTube or any place to see the videos. You can also hear the person who's making the recording trying to reassure Freddie that it's going to be all right. He had it all captured on tape. But what we don't see is the footage of the initial takedown, where just like another poor individual suffered, a knee was on his neck. He was against a rock when he was thrown down too hard, and his cord was severed because he couldn't move his legs, and he was complaining he couldn't breathe, and basically crying out for his life to be spared as he was thrown in that van and then carted off. And I listened to all the excuses. I listened to the so-called evidence that it appears in one frame of the video that Freddie could move a leg when in fact they were lifting his legs for him because his spinal cord was already damaged. But what more struck me about what I saw was what kind of hardened heart approaches this minor incident with a thought that this human life is completely expendable. And even when that human life cries out, hey, I can't breathe, something horrible's going on here, I'm scared, whatnot. What kind of human heart just doesn't care?
Yeah.
And this is my little rhyming phrase all the time in my workshops, and it occurs so many times with character impaired people. It's not that they're not aware, they're plenty aware. It's not that they need to see anything, and it's not your job to waste time and energy trying to get them to see what they already see. The problem is they don't care enough.
Yeah.
And there are reasons for that in our selfish, self-centered, grandiose, unprincipled culture that has created this phenomenon of character disturbance.
Yes, I would agree. Nature versus nurture. What do you think the causes are?
Yeah, well, it's really a moot argument.
Yeah.
And as I say in the workshops, it's not just nature, because nature certainly plays a role. Because there's temperamental variables, there's how the brain's response system is programmed, there's the capacity for empathy. We have clear brain studies that demonstrate convincingly that the brains of psychopaths don't work anything like normal brains. So nature is involved, and of course what happens to folks, it matters too. But more than that, it's a dynamic interrelationship between those two factors. It's not just nature and it's not just nurture. And here's another thing I make a big point about in my book, Character Disturbance. I don't make enough a point of it. And this is why I'm writing the book I'm writing now. It's not just what happens to a person. The more insidious problem for decades has been what doesn't happen. What doesn't the person get with respect to positive role modeling, with respect to tender, loving coaching, with regard to reinforcement of the right lessons, because the wrong lessons are getting reinforced all over the place. So it's not just what happens that impacts a child in their development, it's what doesn't happen.
Yeah.
We are the only creatures on the planet that don't socialize until after hour after hour, day after day, year after year, for years, for many years. That's what it takes to socialize us. No other creatures are like that. Anywhere else in all of creation, no other creatures are like that. So what we learn matters.
I would agree.
What we learn matters. And my gosh, just look at the dominant messages out there in our culture. Who are our heroes? You know, I can remember a time, I sound like an old fuddy-duddy because I am. I can remember, and I wrote this in the opening chapters of my soon-to-come-out book. I can remember when you could have all the talent in the world, but if there was any chance that your behavior could disgrace a team,
Mm-hmm.
neither the players nor the owners wanted you because honor meant something to them.
Mm-hmm.
And they didn't want to risk you bringing dishonor to an honorable enterprise.
Mm-hmm.
So it didn't matter how much talent you had. You had to have character too. Well, those days, I got to tell you, are long gone. And we're paying the price.
I would agree. I would agree with you there. So we're at the end of the hour. I know it went so fast, didn't it?
Yeah.
Tell us about, lastly, where people can find you, what you got going on, if you're doing any more workshops, if you're taking on consultations, or, what sort of stuff you've got going on.
Well, PESI is my workshop sponsor, and all in-person appearances have been canceled as a result of COVID concerns. But you can access the recordings of live streams, and you can access a program specifically recorded for professionals at their website. So you just go to PESI.com and you can access the training if you're a therapist. Lay folks can purchase any of my books from Amazon. They can get them in ebook format, audiobook format too. And my website and blog, either manipulative-people.com or drgeorgesimon.com. That's drgeorgesimon.com. Either URL will take you to the same place. Hundreds of articles, informative articles, one a week.
That's awesome. And I look forward to seeing your new book. I don't know, when is that expected to come out, do you think? Or
Well, I'm hoping to finish the main rewrites in the next 4 or 5 months, probably the very first of next year. And maybe we can have another conversation then.
That would be great. Actually, I'm looking forward to it. So, and I can't wait to read it, especially with the updates and everything with pertaining to current, what's going on in the world today. So I'm excited for that book, and I'm excited for you. And I so appreciate you coming on the show to talk.
Well, thank you for having me. I really appreciate it.
You're quite welcome. Thank you. Okay, now that you've heard the show, I really would love to know what your thoughts are on the show. So please be sure to follow us on social media, Instagram, and all that kind of good stuff. Again, all the links for Dr. Simon's books and for social media and the website, all that stuff is going to be in the show notes. So just hop on over and take a look at that. If you can't remember or you want to stay in touch with us, love to continue the discussion rather. And thanks so much. And until next time, be well.